Welcome and thank you for joining us here today. My name is David Carroll and I'm the Executive Director for the Greater Englewood Chamber of Commerce. We are back with our next series of webinars. As our state considers moving into the Protect Your Neighbor phase, we wanted to address new topics on the reopening that many of you have been asking about. Again, we've partnered with the City of Englewood on this effort, and today our Mayor, Linda Olson, will start us off with a few words of support. Mayor Olson?
Thank you, David, and thank you to the Chamber for putting these on. And I love the backgrounds you provided from murals in our great city. This one, I believe, is from Zomo, right? So the global pandemic put many of our lives on hold and continue to do that. And we're all very aware and kind of together in this. And while our healthcare system really pivoted quickly in February and March regarding COVID-19, things like routine health screenings have been delayed for many people, which is not good. And we also know that people have avoided and continue to avoid potentially life-saving care. Research is showing out of the health insurance company Cigna recently, they analyzed hospital admissions and found that many people have acute and emergency medical conditions are not going to the hospital. And between February and March alone, the hospitalization rate related to atrial fibrillation decreased by 35%. Mini stroke hospitalization declined by 31% at the same time frame, and double-digit declines were recorded in the rates of epileptic seizures, gastrointestinal bleeding, heart attacks, and appendicitis. I'm not the specialist on this here today. We have a doctor with us who is a medical doctor, but I did want to mention these because we do want to make data-based decisions and help the public understand what's going on. And we've seen indications of these national trends in our own local hospitals here in the Englewood community. And this is dangerous for our Englewood residents and surrounding communities. Delaying or avoiding critical Medicare for emergencies such as heart attacks, strokes, or serious injuries can result in really serious health complications and in some cases death. Now that some of the restrictions are being lifted and we're resuming a normal life, many of our patients and family members that have issues might still be anxious, and understandably so, about visiting healthcare facilities during this time.
Well, thank you, Mayor. That was really hit the nail on the head of what we're trying to talk about today. I mean, as we consider this third phase of reopening businesses that allows larger groups to gather, we wanted to explore how we could keep ourselves healthy. Is it still safe to go to our doctors for cancer screenings and elective surgeries? So to help us answer that question, we've asked Dr. Monique Butler, Chief Medical Officer of Swedish Medical Center, to help us out. Dr. Butler, how important is it to continue our scheduled medical appointments?
It's very important. Thank you very much, David, and great to be with you, Mayor. Very important for us to ensure that we're putting ourselves first and making sure that our healthcare is at the forefront of what we do every day. You know, here at Swedish and throughout Health One, we are taking extra precautions to keep you safe. We are ensuring that every single patient who comes through our doors, their visitors, our staff, our employees, they are screened with 3 questions to help us stratify the risk. And there's temperature screening. And if they have a higher temperature, they are sent home. We are making sure that our hospital is cohorted, where we're dividing off those patients who are COVID positive. And so we have many areas in our hospital that are COVID free. All of our caregivers wear masks. The CDC guidelines talk about universal masking, and we've taken it to another step here at Swedish Medical Center and throughout Health One, where all of our caregivers, every physician, every nurse, every EVS worker throughout our facility participates in our policy of universal masking from the time they come in until the end of their shifts. And then most importantly is our heightened sense of awareness around infection prevention policies, hand hygiene, making sure that we're washing our hands. And one silver lining of the COVID pandemic is that our hand hygiene processes have been enhanced substantially. Our food and drinks are prohibited in the areas to prevent the spread of illness. And so we're taking a great number of steps to ensure that you're safe. And so I want the community to know that if you're experiencing chest pain or sudden dizziness, difficulty breathing, signs of stroke with facial drooping, lack of speech, or difficulty understanding what someone is trying to tell you, don't avoid or delay life-saving care. We are here for you and ready to take great care of you.
Thank you so much. And that's such an important message to get out of there. From a public health perspective, have you also seen maybe a reluctance or a decrease in vaccinations? People being concerned about going into their pediatrician?
Yeah, absolutely. Since the COVID-19 pandemic, understandably, there's a fear and anxiety from going into physician offices or hospitals. And unfortunately, we're seeing a dramatic decrease in the number of cancer screenings. We're seeing a huge decrease in the number of children who are receiving vaccinations. So I want to make sure that everyone understands the importance of getting in touch with your pediatrician for your children, whether it be virtually or in person. And I'm sure they're taking the steps and precautions of keeping their offices safe. But we want to make sure that we're following the recommendations from our physicians and our pediatricians regarding vaccinations for our children.
Thank you so much. And it looks like Mayor Olson, do you have a question?
I do. I often get questions from my constituents about what can they continue to be doing at this time to be safe themselves and keep others safe. And of course, some of the confusion around that. What is the word we need to be repeating to them?
Sure. We should follow the CDC guidelines that recommend when we are in public, when we leave our homes, we should be in masks. So that we should ensure that when we are in crowds of other people that we wear our mask, and we want to make sure that we try to stay away from the crowds as much as possible. The CDC guidelines are 6 feet distancing. So if you go into a place and you're unable to really get that amount of distancing, you may want to avoid that interaction or that gathering. But we can't stress the importance of masking while in public and distancing about 6 feet from the next person.
I have mine here.
I have mine too.
And it goes everywhere with me, and I have an extra in the car, so I appreciate that word.
Yeah, that's very important, Mayor. Thank you for that question.
Well, thank you so much for sharing this with everyone. This has been great. I know your staff has provided a video that really summarizes our discussion today, so we will play that next. Thank you everyone for watching, and we look forward to sharing more guidance as we reopen soon.